Welcome to The Digital Patient, where we discuss the latest advancements in digital patient engagement and share stories from the front lines. I'm your host, Alan Sardana, and with me as always is Seamless MD's CEO, Dr. Joshua Liu. Today we're joined by Ms. Kali Arduini, the Director of Innovation at Northwestern Medicine. Ms. Arduini, Kali, welcome to the show.
Thank you. Glad to be here.
Yeah, we're so glad to have you on today. You've had such a diverse career that's really spanned the roles of technology, operations, and now innovation in healthcare. And so I'm really curious, there's a common theme there, which is healthcare. So what drew you to healthcare and healthcare technology in the first place?
Certainly. So my mother actually was in healthcare. She was the administrative coordinator for a physician in Central Illinois who specializes in treating children with early childhood diseases. And I grew up going to daycare with those kids. I grew up very much close to healthcare, seeing just the challenges people face and how these amazing caregivers can impact their lives so much and really help them. And so as I was getting through school, I kind of started looking in the healthcare space, but very much on the business side. I had zero appetite for being clinical, had a little queasy stomach in some of those situations, so it wasn't really best to go into that space, but was really excited to kind of see the business side of healthcare, and that's where I looked.
So you ended up for a number of years at Epic, which is not maybe a little bit uncommon for folks to end up actually on the healthcare system side of things. So I'm curious, how did you land that gig, and what was your experience like there?
Yeah, I took that interview for practice. So it was my senior year of college. I knew I hadn't had an interview in a few months, and a friend of mine worked at Epic, was coming, said, "Hey, you should interview." And I was like, well, I'm never going to live in Wisconsin, but love to interview. And as I learned more about what they did and kind of the scope of what they did, and then they fly you to their campus, which even back when I was graduating was impressive, just really got swept away with it all and ended up falling in love with the idea of that job and stayed there for quite a few years.
What was your favorite themed room at Epic?
Oh, that's a good question. I was in the jungle building, and which is very fitting for me. I am a warm weather cat, very big cat person. And so they had quite a few rooms with a snakeskin wall and just really neat art and decor around. So I love that was where they ended up putting me.
That's awesome.
So I was curious, innovation is often kind of undefined and kind of amorphous and very hard to pin down exactly what it is, but obviously is tremendously important. At some point after Epic, you fell into this realm of innovation. I'm curious, A, how would you describe what innovation is? And then B, how did that happen for you?
Yeah, I feel like that word innovation gets used in so many different ways that you almost have to define it in terms of what you work on and what you focus on. And so for me in my current role, it's really the latest innovative technologies that aren't necessarily proven or widely used yet, but really being open and creating an environment that allows us to explore, to try it out with low risk, but in a way that can be meaningful and ensures that we are tracking the value and defining kind of what we're looking for, what the outcomes are, and ensuring that we meet them and being willing to fail. And so we also provide an environment where we can try something, and if it doesn't work, okay, that's not necessarily considered a failure broadly in the sense of that word, but we now have insights and education and understanding based on what we learned.
So, I think we find that depending on the health system, depending on maybe the size, the resources, innovation groups and centers don't always exist. Like Northwestern, I guess, is fortunate that yourself and the innovation group there does exist. How would you describe maybe how you might approach things differently with an innovation group versus maybe a health system that, has digital IT, has clinical operations, but maybe doesn't have a dedicated innovation group? What are you doing maybe differently?
Yeah. And, the thing about innovation is I sat in a presentation years ago and the speaker started off by saying, innovation isn't a team, is a department. And I agree with him. It's truly the culture and the comfort and the ability to be able to explore unproven things in a safe way. And so that's really what I focus, our work on, whether it's a dedicated, department and team like we have, or it's just a few individuals within a larger organization. It's really just giving your workforce a space to take risk and trying to de-risk that as much as you can and providing the funding and the resourcing to be able to do it effectively. But really for us, especially in the technology space, it's really just giving us a space that even if regulations are, changing and we've got a lot of resources focused on that, or, the continued challenges healthcare has both from the financial side of things as well as burnout of the workforce and just turnover and things like that. A lot of folks in the organization have to focus on that and need to focus on that, but we don't want to lose sight of their new technologies can actually impact those challenges as well as others, and we need to have sort of a little bit of a dedicated brain power to be able to explore them.
Today's episode is brought to you by Seamless MD, which enables health systems to digitize patient care journeys, leading to lower lengths of stay, readmissions, and costs. Josh, you used to be a doctor. Did you ever feel like patients showed up unprepared for surgery? Or maybe you felt like you were sending patients into a black hole after discharge?
All the time. We give patients paper and verbal instructions, which are so easy to forget and really hard to follow. And we have no idea what happens to them outside the hospital. So what happens? Well, because we worry about them, we keep patients in hospital longer, but that drives up length of stay and lowers throughput. Plus, after they leave, patients get readmitted for infections and all kinds of problems that we could have just caught earlier if we monitored patients.
What if I told you there was a way to give every patient a virtual companion so you could automatically engage and monitor them through a surgery, a cancer journey, or a chronic care journey, and drop the length of stay, increase throughput, and lower readmissions?
Gosh, Alan, that would be amazing.
So that is exactly what Seamless MD does. It allows health systems to engage patients on their own phone, tablet, or computer with automated reminders, education, and symptom monitoring. Basically a GPS through any healthcare journey.
That sounds fantastic, but does it actually work?
It does. Health systems have done over 40 studies and evaluations showing how they use the solution to reduce length of stay by 1 to 2 days, readmissions by up to 89%, and costs by over $1,000 per patient.
But how does that work with my EHR?
That's the best part. Seamless MD is the only solution in this space with direct integration partnerships with Epic and MyChart, Oracle Cerner, and Meditech.
Well, I am getting a colonoscopy soon, so I really need something like this. Where can my health system learn more?
Well, Josh, thanks for letting me know. Your health is very important, and endoscopy is just one out of the 50 plus out-of-the-box care plans available today on Seamless MD. Go to www.seamless.md. That's www.seamless.md to learn more.
How have you figured out, the best way to organize innovation at Northwestern? And what I mean by that is it more of, hey, we have an innovation roadmap for the healthcare system, and you're kind of planning that and you're defining it and then you're educating folks on it? Or is it more of hey, actually, we're the innovation hub where with frontline staff or clinicians come up with new ideas or things that they want to get help solving? We're the hub for that. It's a bit of both. Here's how you think about innovation in that context.
Yeah, I would say it's less that we have a separate roadmap from the organization and more that we just stay super connected to the biggest problems, the focus areas, the priorities. What are our senior leaders? What's keeping them up at night? What are the biggest problems that have, perpetuated for a long time? Maybe there hasn't been a good way to automate something, or we've had projects on certain challenges like length of stay and things like that forever. How can we bring the latest and innovative technologies to those challenges and take the capabilities that we have and really try to look at those problems in different ways? And so I would say really what we do is focus on connecting with our leaders, knowing what the priorities are, and then really just checking with folks throughout each year of, hey, we've heard about these new capabilities that could impact X, Y, or Z. We know this is a priority. Is this something you're interested in? And so it's really being more of a resource and an area for folks to go if A, they have a problem they want assistance solving, or B, they've heard about a solution or they have an idea for a solution and they want to be able to pursue it with some support.
Well, one of the, I guess you would classify it maybe a little unproven technologies today that's making all the buzz is AI. And so we have to dig into that on this podcast. I'm curious from your point of view, what do you consider to be maybe the low-hanging fruit, the highest ROI use cases for AI that maybe you've seen versus the ones that you believe are maybe overhyped today?
Yeah. I would say in terms of low-hanging fruit, and I'm sure this is nothing for those who, think about AI in healthcare all the time, radiology is just so prime and imaging is just so prime for the sophistication that our sort of traditional AI has. out there. And so we at Northwestern have been at the forefront of that, both partnering with outside solution vendors, whether it's startups or big tech, as well as developing it ourselves. So we have invested in AI and ML teams, engineers who can, when maybe we don't need this an entire platform to solve a problem, but there's a particular need, a sort of targeted niche need, we can also create it for ourselves. And so I would say that is where we got started and have had a ton of success, and we're just seeing so much value. So I would say that's very much low-hanging fruit. I think with the more current buzz with generative AI, I feel like it's also worth hitting on low-hanging fruit there, which for us, the most value-driven solution we've been able to work with lately is the ambient world. And so really using AI to listen to those conversations we're having with our patients and draft those notes on behalf of our clinicians. And we have just seen such impressive results. It's surprised our physicians how effective it's been. We've been really surprised at the value and the outcomes we've gotten from it. So I would say those two have really been the areas that I would say it's not hype, it's real and quite impressive.
I'm always curious for something like Ambient. Where did you decide to start at Northwestern? Was it a certain like clinical group or certain type of clinician profile? What worked for you as a starting point?
Yeah, we really looked to kind of our vendor at the time to say, hey, where do you see this being the most valuable to start with? And it was primary care, which makes sense. Their notes are often templated, broad, extensive, since they are comprehensive of the patient as a whole. And so that is where we started, though we didn't want to leave out the specialty side. And so our original pilot was 50 physicians. 2/3 of them were primary care. And then we had a smattering of cardiology, endo, ortho, and a few others who we had champions in that really wanted to be at the forefront and took on this tool, even though we told them it wasn't necessarily optimized for them, because they were so interested in kind of seeing what it could be. And now we have 300 physicians using it just in the last 4 months. And then, and there I think it's about 2/3 primary care, but then the other third is pretty much a representative or a few from all of our major specialties. And the feedback is just impressive and glowingly positive.
That's amazing. And I'm guessing that it's still kind of voluntary in the sense that clinicians, it's there if you want to use it. No, if someone just really wants to keep typing their own notes, they're free to do that. I'm assuming that's the case.
For the most part, yeah, it's primarily people who are interested and volunteered. But we also looked at physicians who were spending their evenings documenting, physicians who were struggling to get their visit documentation completed in a timely manner. And so we also went to them and said, hey, we want to offer this tool to you and have you try it. And so not necessarily a mandate, but more of a, hey, this isn't just, you didn't come to us asking, but we actually think this might help you. And so we're proactively coming to you with this offer.
And what's the best way to do it? Is it that you have, I don't know, like internal clinical champions who are the ones demoing it to their peers? Is it that kind of your team are the ones like boots on the ground, like demonstrating how this works to clinicians? Like what's been the best way to educate folks?
It's been fun. We are so committed to this that it's sort of like a 5-prong approach. We're essentially choose your own adventure, choose your own journey. We know adults learn differently and adopt differently. And that's really why, like through our change management approach, we've said, if you self-learn, you can do it that way. If you'd rather sit through a demo or a webinar for 15 or 30 minutes and then answer some questions, we've got that for you too. You'd prefer watching an e-learning, we've got that as well. And so we've done a few different approaches in terms of in advance of them getting access to the tool. But then in the few weeks after, we offer essentially office hours with a combination of our, tech teams and the vendor. So if it's just simple questions about how does it work, what do I do, they can help. But then we also have a couple really impressive physician champions who get on those calls and have been using it extensively and can be a peer to provide that additional sort of peer insight.
I love this. So it's kind of like you're finding ways to educate and reach clinicians in the way that they want to be reached. It's not like a one-size-fits-all educational process. That's really, really smart. Total close side note, but when you brought up Choose Your Own Adventure, this might date me, but like I remember growing up reading those Choose Your Own Adventure books. You guys remember those? I don't really do those anymore. But I remember when I first read them, I didn't understand how that works. I would just read all the pages in sequential order, and I'm just like, I don't understand what's going on in this book. I don't know if kids have that today, though.
I don't know. They do if they join Northwestern Medicine, apparently. So that's great. So, Kali, one thing I wanted to note as well, you mentioned that you're focused around driving value, and I think that's obviously admirable. Sometimes when it comes to things like Ambient Scribes, the value is a little bit untethered to actual outcomes. What I appreciate is there was a recent press release that went out for the Northwestern Medicine Ambient Scribes, and what it found was actually the providers were able to take on an additional 11 patients per month while decreasing at-home or after-hours charting by, I think, 17%. So first of all, that's amazing. And I'm curious, when you were setting up your pilots, like what was your original success criteria? Were you looking at, can we take on more volume?
It's a good question. So I would say we knew this tool could decrease the amount of time our clinicians spent documenting. And so our key sort of driver metrics were, one, time spent in notes, which is easily calculatable with the tools within our EMR. And then we also wanted to look at that concept of after hours charting. So in Epic, it's pajama time, but it's after 8 p.m. How much time are you spending in the EMR after 8 p.m.? And so we thought if we could tackle documentation, that would drastically change. And while the time spent in notes did for just about anybody who truly adopted, and when I say truly adopted, it is you're using it for at least half of your visits, we did kind of distinguish between the folks who, like, you could tell were committed and really used it and were using it for the majority of their documentation versus those who dabbled, so to speak. And so we really focused our metric measurement on those who were committed and using it pretty extensively. And so with those folks, saw an immediate drop in the time they were spending in the note. That after hours charting or pajama time took a little bit longer. It was probably a few months before we saw that, but that also dropped. And the reason we knew pajama time wasn't necessarily an indicator that it wasn't working is because Epic doesn't distinguish between what you're doing in the EMR after hours. Right. So they could still be managing their in-basket. They could still be reviewing their charts for their next day. And so it wasn't necessarily a direct relationship to, like, was it documenting in the patient's charts. And so I would say those we knew we would get an impact on. We did. So that was expected. That organic growth and additional patients was a complete surprise. We thought maybe, the vendor kind of said, hey, other places are seeing an increase in visits. And we're like, yeah, we'll see. This is more of a wellness play, but we'll see. And that average of 11 patients per our physicians who really committed and used the tool, like, that wasn't a mandate. That was us saying, we're going to give you this tool and let's see what it can do for you. And then some of the physicians didn't even realize they were doing it. They just, when their manager came to them and said, hey, I've got a patient that needs to get seen and you're not available, can I squeeze them in? They weren't as burdened. And they said yes more often. And so that's what we realized, was that it's organic. This wasn't a mandate. This wasn't us telling them. It was, hey, we're giving you a tool to make your lives easier. What you do with that extra time, it's really up to you. And they're giving it back to their patients, which is great to see.
And it sounds like across the board, generally speaking, patients have been pretty happy, pretty comfortable with this. So I'm not in the room, obviously, but I'm guessing the communication is like, hey, like, this is this new thing that we're doing, but it's going to allow me to actually give you like literal face time more than I could before, be more present with you. Is that okay? And I'm guessing most patients are like, yeah, it'd be nice if you actually looked at me for once. So is that kind of the sense that you got in terms of the patient reception?
Very much so. And we actually have, like, the real feedback to back it up. So we have in our patient satisfaction surveys multiple comments of, my physician was using a new tool and I felt they were so much more engaged. And then you have the feedback from our physicians saying, it just felt so much better being able to be face to face with my patient and look them in the eyes consistently throughout the visit instead of having my hands on the keyboard and really focusing on getting what they need into the computer. And so it's been on both sides. I think we're hearing that we thought patients would be a little bit nervous about a recording device, because I mean, it does seem that way, even though we don't store these recordings and it's not necessarily that type of a thing. But vast majority of patients have zero concerns with this. And when you tell them that it's going to help the physicians, they're like, that's great. Yeah, I know you're emailing me at 10 o'clock at night. I would love if you could have some of your time back.
Amazing. So when you think about, I guess, going to next year in 2025, and I know obviously maybe this isn't fully fleshed out, but are there certain other like AI use cases that you're like, okay, like, this could be the low-hanging fruit next in our roadmap? Does anything come to mind lately?
Yeah, so there are a few areas. So we pulled the data from Epic on where clinicians are spending the majority of their time. And number one is documentation. Number two is in basket. And number three is chart review. And fortunately, right now, there are multiple players in the AI space trying to tackle each of those. And so we're already early adopters and trialers of Epic's AI solutions that are hoping to help with chart summarization and in-basket management. There's some challenges in those areas that make it a little bit harder for that AI to be available sort of out of the box. It's newer too. It's only been around for the last year. So we're looking at a couple different ways to mitigate the challenges in those spaces. And then the other area that we really dove into open-mindedly in the last 6 months is using generative AI to make phone calls on behalf of our organization. And so we're working with a couple different startup partners, and then one internal project. We're creating it ourselves. And we are exploring, can these AI solutions, these AI models, take on some of those very templated conversations? So I think colonoscopy prep, where we're calling every patient, making sure they got their prep, making sure they know what time they've got a ride, all of those items. It's very prescriptive. And we stop some of our teams of nurses from having to make those phone calls. Same thing in like the OR space, so pre-op, post-op phone calls, post-discharge, when we call patients just to make sure coming out of a hospital stay that they're settling back in at home and they don't have any questions now that they're home. And so we're excited to explore that space. We're doing it very carefully, but certainly looking at a few different ways that AI can continue kind of shifting our workforce and especially our clinical workforce to more of that direct patient care and not some of those administrative activities.
Is part of the challenge, let's take the colonoscopy use case as an example, is part of the challenge that the patient might respond, may have a clinical question about it, and then you'd have to have a really well-developed, I guess, AI response to that, versus like if you were looking at more, back-end office type phone calls, maybe just scheduling the appointment, but not a clinical thing. Maybe that's probably a little bit easier, lower risk. So kind of curious, is that part of the conversation for why it might take longer to flesh out some of these new AI use cases?
Certainly. Yep, you got it. And really, we want to be smart about where we're putting the AI and who we're freeing up with some of this automation too. And naturally, physician burnout, nursing turnover are some of just the biggest realities we're facing. And so we're starting there, but also recognizing that those conversations are clinical and often more complex. And so which of those conversations tend to be less so and could at least be a good starting point, knowing that there's always going to be a situation where the AI can't answer and there's got to be a step for it to be able to say, let me connect you with the real individual. But if we're making 60,000 phone calls like we are for discharge follow-up, and right now, we actually only connect with half of those patients because they don't answer or they're not available, or we play phone tag and the patient stops responding. Could AI at least take that first, hey, do we even have any questions? So that we can take some of that burden off of nursing teams who are stepping away from bedside care to do that today.
There are those, and maybe you're already using this, but in the business world, like let's call it like companies, some of them are using those, Al, what do you call them? Like automated, they call them like outbound calling software.
Yeah.
It'll call like people on like let's say you're a salesperson, right? You're calling people on a list, but it'll automate all the calls, and then only the ones that pick up will it connect to the salesperson. So they're not actually doing all the dials. Is healthcare doing that at least, or is that not that common when making calls right now, like manually?
Fair. I would say with outreach campaigns, I would say some health systems are like there's CRM solutions and tools that can do that, especially for, to your point, like high volume campaigns where you're just contacting a lot of folks. We're also looking at it from does that have to be a phone call? We're finding more and more that patients don't necessarily want a phone call as that first point of contact. Like you could text them and say, hey, how you doing? Would you like to hear from a nurse about your recent hospital stay? And if they say no, well, then we've saved a ton of effort and phone call and all of that. And so I think it is just finding that mix of tools that reaches out effectively, but then allows for the more high touch interactions when appropriate.
Right. It's funny. I think like even like 10 years ago, I think people were still saying like phone call was better for patients, not even text. And now we're already jumping to like AI agents 10 years later. So it's incredible how much has happened in even just 10 years.
Yep.
Yeah. So Kali, another initiative, really exciting program really that I heard you're launching. I believe Northwestern Medicine has partnered with Techstars on this, but it's an accelerator program for 6 startups. I think the applications are open now and the program starts March 2025. So I'm curious, with this accelerator program, like what key areas of healthcare innovation are you most eager to explore in that kind of accelerator setting with these startups? And what kind of impact do you hope the startups will have on patient outcomes and just care in general and provider well-being?
Absolutely. We haven't narrowed the focus of this inaugural program too specifically. Very much kind of some of the topics we've talked about. So we're very much interested in continuing the AI automation journey, robotics, even device and pharmaceuticals to some extent. We know there's a lot going on out there. And so I would say this is our first year. We're very excited to partner with Techstars. Finding a global leader in this space was exactly what we were looking for. But you'll notice, if for those who are familiar with accelerators, typically they're 10 to 12 startups, and we really narrowed it down to 6. And that was intentional because we want to add a component of not just advising and mentoring these startups, but actually pursuing pilots and being a meaningful partner in terms of getting them evaluated, assessed, and ideally incorporated into the work that we do. And we know that in order to commit to that, in terms of the resources we have available, we needed a smaller cohort this first round. And so we're really excited to work with these startups, knowing their early stage. They may even only have prototypes at this point, but that's really where we think there's a lot of opportunity to get on the ground floor, leverage our expertise, leverage our relationship with Northwestern University, and really bring that to the forefront with these founders and with these innovators to continue impacting where healthcare is headed.
Mm-hmm. Yeah.
Yeah, actually, so, one of the challenges of healthcare is that things do take longer than in some other industries. So, in a non-healthcare accelerator, let's call it, a lot can happen in 12 weeks because you're not having to go through complex, regulatory or other things. Healthcare is obviously more complicated. So I'm curious, like, as startups go through this, what would be a good outcome in 12 weeks in your mind that's reasonable, for both Northwestern, but also the startup?
Yeah. So I would say much of like the traditional accelerator approach, where these folks are getting connected with mentors, both from within our healthcare organization. So if it's, a cardiology specific solution, they're getting connected with our cardiac teams and able to shadow and understand how could their, technology really work? Is it novel? Is it meeting needs? Can we get them, a champion or a mentor from within the department to really kind of spearhead within the organization? But also the external, they need access to venture capital. They need, other entrepreneurs, frankly. And so we want to leverage Techstars and their vast network to really provide those connections, along with the workshops and a lot of the boot camp style entrepreneurial work that those accelerators do. But really for us, then that 12 weeks is also rapid fire internal NM evaluation. And so we will actually take you through our typical process with early stage companies of, let's understand how your solution could fit, who the experts would be, get you through security and integration review with our IT teams. If there are compliance, regulatory concerns, how do we dive into those conversations quickly? So I think our goal by the end of that 3 months is not just that they can do a really great pitch at the end about what they've learned and kind of the improvement in their either business model or product throughout those 12 weeks, but they also then can say, and here's what we're doing next with Northwestern Medicine in terms of continuing here to shoot for that impact we're going for.
Yeah, the thing that stood out to me was your comment about it would actually get into the clinical environment, shadow clinicians, get boots on the ground, on the units there, because especially like the early stage companies, I think often technologists on the outside who've never been in the clinical environment, we have all kinds of assumptions about, like, frankly, how easy things are. And then when you actually step foot and you look and you watch and you realize, oh my gosh, this is the most complex environment possible in the world, then they can truly understand like what they have to solve to make the idea work. So I think, at least for me, like hearing that, hey, you're actually going to get boots on the ground and exposure, especially if you're in early stage, you haven't really had a chance to get in there. That seems really amazing. So kudos. So March 2025, it starts. Oh,
it does.
That's gonna be really exciting. Wow. Okay.
Great. Applications are open now through November. So excited to see who comes forward.
Yeah.
I'll
Awesome.
have to put that in the show links.
Definitely. So actually, it's funny. My brain immediately, when you're saying, okay, we'll take them through security and compliance and understand the regulations, my brain is going, all 6 of them are going to fail. That immediately, just because it's so, complex to get into a system. But I'm sure it would absolutely be invaluable learning for anyone to do that program. You mentioned as well with this Accelerator program that many of the teams will be kind of before their MVP stage. So they don't even have necessarily a working production product at this point. So I'm curious what criteria or qualities you're looking for in the 6 startups that would be attractive for you to actually take them into the Accelerator program.
Yeah, I think we've really learned, at least since I've been kind of leading innovation, just the importance of that founder team and that executive team of the startups. They can have a very early idea or even just a simple prototype, but you can often tell by interacting with those founders, do they have the rigor? Do they have the commitment? Do they have, sort of that entrepreneurial spirit to be able to kind of take it forward, but ground it in the real world? And so making sure that they appreciate, like, you do need to be boots on the ground and shadowing. You do need to listen to the experts and adjust. You do need to think about change management and incorporating your solution and not trying to make folks drastically change what they do just to use your solution. And so I think that's a lot of what we're hoping to surface throughout the program, as well as, how ideally throughout the selection process, we'll be able to narrow in on some of that. But you also in those 12 weeks get a very real feel for these leadership teams and whether they can go the distance, which I think will be a key part of it as well.
Yeah, awesome. So one thing, actually, it's a great way to transition over to a question around change management. You've been behind the scenes on so many different innovations at Northwestern today, ones that we haven't even talked about on this podcast, but, we're running out of time, so we probably won't dive into a whole tangent here. But generative AI projects, NLP projects, hospital at home, different initiatives with like Moxie the robot, for instance. I'm curious with change management, obviously that is such a crucial factor in successful implementations of any solution. So I'm curious your approach to change management at Northwestern. How are you going about ensuring that both clinicians are understanding the different workflow changes that could be happening or the different technologies that are implemented and how that's embraced into their current workflows? What's your kind of key takeaway or high level on change management?
Yeah. And I think for us, I helped found the project management office here at Northwestern Medicine back in 2018. And so, very much grounded in just the resources available, the methods out there for change management. I think instead of us picking any one framework or things like that, we don't focus on the framework. It's more just the goals and the outcome. And so for us with change management, we make sure that our pilots are small enough that we can work through that hand in hand with the folks who are involved in it. And so Ambient and Moxie were both great examples. There wasn't really a playbook for the change management of those tools. We have great vendors who are providing their insights, but then we're also working across our organization to bring in people, whether it's communications, whether it's training, whether it's the operational folks, facilities, all sorts of individuals, to say, hey, we're going to be making this change. Help us think through every possible component of it and who we need to talk to and how we need to get out there. And then, again, one of the benefits of being able to curate a team for innovation is I was able to pull folks who had 15 plus years of experience in project management and implementing change. Between our team, we're able to really think through, hey, for this type of solution and this target audience, how have we successfully communicated with them? What are the methods? And then also just asking some of those key champions, hey, would this work or do you think there's a better way? And really making it a collaborative approach to figuring out how to get out there. And then also being willing to adjust. The Ambient work was a great example. Like, we started piloting based purely off the vendor, and every single physician had to have a 30-minute call with the vendor. Half of our physicians were like, I did not need that. And so it was also, a little bit of cater it as you go, learn, be willing to iterate and change and evolve. And that's really when we're going to be successful.
Yeah. I love that. So adaptability and over communication, hitting on all those different learning modalities.
And Moxie is great. The robots are a great example of just a very different type of change management because somebody's not using that robot. Like, they're not interacting like with a keyboard or an application. But we had to think about anybody could see that robot and employ like a physician, a nurse, our environmental services, our transport, our patients, visitors who just come into our hospitals because they're in downtown Chicago and there's a restaurant inside. And so it was also, how do we make it approachable and not scary and get communications out there? And so it was a lot of videos. People are very, very used to seeing Moxie now. For the first 2 weeks, Moxie was roaming our hospital, just had candy in its basin. Well, we didn't even have it working yet. We're just like, let's get people comfortable with a robot walking around. And it worked. And then, every time folks would send us photos or selfies, we actually put those out on our intranet site and said, hey, look, Moxie in action. And so it stopped it being this like, eek, there's a robot over there. And it's just part of our culture and part of who we are. And so that was...
I love that. It's almost like a precursor. If there is a robot revolution and they take over, as long as they have candy first, that's the path forward.
And hearts for eyes were helpful too.
Right.
If there was a robot handing out candy, they're more than welcome to come to my home and stay here. Yeah. So by all means.
We'll send it over to you.
Also, I wanted to ask you, so, as someone leading innovation, you probably get emails from startups all the time trying to get in front of you. It's probably, I'm going to guess at this point with all of the automated email stuff that now exists in 2024, you probably get an overwhelmed inbox. You probably ignore most things. I'm curious, for startups who are trying to collaborate with Northwestern, like, what's sort of your recommendation on, like, what's the best way to do that? Is it still to try and contact someone like you, Kali? Is that maybe totally the wrong approach? Like, what's your advice to startups in general?
It's a fair question. I'm not sure there's any one answer. I think for an organization like ours, where we have an innovation team, we do try to act as a bit of a clearinghouse for our clinicians, because naturally vendors are going to get to whoever they think is going to be interested. But we also often, especially from our executive team and our senior physician teams, like, they'll just forward stuff to us. And again, we act as a bit of that vetting authority to say, okay, it's very basic questions. I'm clearly not a decision maker and expert in most areas of healthcare, as I'm not clinical, but I can tell you whether this is actually meeting our definition of novel or not. So if somebody comes at us with a faxing or paging solution, we're just not going to move forward. Like, we're not even going to explore it, because that's pretty outdated. We can understand, is it truly novel? Is it tackling a high priority problem? So that's back to, we're staying connected to the organization, understanding what our priorities are. Because there are a lot of great solutions out there, but they are not hitting on our top problems. And so at this point, we really can't explore them. It doesn't mean it's not a great solution and it can't bring meaningful impact. But for our organization, we have to stay pretty focused. But I can also very quickly understand, like, are we already exploring this area? So Ambient's a great example. We already have a vendor. So if others reach out to me about their Ambient solutions, it's a very quick thank you, but no. And so we do want to stay in that role to help the organization kind of stay focused on where we are. But I would also say, we've had many of our clinicians or nurses go to conferences or connect with folks and then reach out to us after the fact and say, hey, I've had some good conversations with folks. Can you help us think through the next steps here? And I would say both ways work well. And so I'm not necessarily sure there's any one way I can say. I would say if there is an innovation team, they're often really good at connecting. And so if you can get with them, they can usually help when, it can be tricky to know who to go to, or if your solution would be interesting to multiple leaders or different teams, they can kind of help pull them all together.
Right.
That makes sense. And I guess one of the tricky things I've noticed in just the general industry is that almost like the more niche a solution is, it doesn't mean it's not useful. But if it only applies to a very smart part of a very large organization, it can be very hard to get mind share. So like, imagine, I don't know, like a solution that's like very specific to the NICU, for example, could probably help a lot of families and newborns. But then when it gets forwarded internally, it's like, okay, how does that align with system-wide priorities? And it could be a very hard pitch. So I don't have a good answer for that, but I think if you're in the shoes of someone in innovation or leadership where it's like, I have this massive organization to take care of, and there's like 200 different really neat niche solutions. Like, what do I do with that? It's a lot to take on.
It really is. And like I said, like, we've had some incredible founders from wonderful startups who are hitting on really meaningful needs. And it's hard to say no because they've got some great ideas. Look at the impact we can have. But again, we have a limited number of resources. We have limited funding. got to kind of focus. And that's tough, especially when there's so much innovation happening in healthcare right now. It's hard not to get caught up in everything.
Yeah, totally.
So Kali, last question that I had, I noticed you also have quite a creative side, and perhaps that is a given living in Chicago. I'm pretty sure you're into blues music and cosplay. I might be wrong there, but I was curious how these personal interests of yours influence your approach to possibly innovation and leadership in healthcare, or if they're just purely a creative outlet.
You've done your homework, Alan. So I would say I have been a huge music fan for a long time, and blues is part of it. I love blues, jazz, a lot of classic rock as well. It permeates in everything I do. And if I try to kind of relate music to this, is it's ever changing. There's different components of it. These days, the variety of people who can become musicians is also incredible now. You can play an instrument, you can just sing. Now with all the synthetic kind of DJ type stuff, like you don't even have to have any skill in like a musical instrument or a voice. You can actually use digital tools to still create incredible music. And so thinking back to like innovation and the work that we do every day, I think it's just a good example of what folks can be capable of if you give them the right tools. Pretty much anybody can be really successful. So I kind of think through that a lot in what I do. And then the creative side, it's funny that you mentioned cosplays. My husband's very much into that. And it has been a slow incorporation into my life as we've been together. I always loved Halloween, always loved getting dressed up. And now I find that we're doing it way more than just Halloween. But it's fun because I've had full face paint and wigs, and nobody knows who you are, and you're sort of uninhibited and can kind of have conversations you wouldn't normally have because you're afraid of who's looking at you or what you're doing. And so it makes you approachable, makes you relatable, lets you kind of get past your own insecurities. And so I would say that helps a lot in the work that I do, because a big part of innovation is getting out there and knowing what's going on and having conversations like this, going to conferences and walking those exhibit hall floors and just meeting people and being familiar with what's out there. And that's not necessarily a natural skill that I always had. And so I would say it definitely kind of helps to get out there and meet different people and do it in a way that's fun and enjoyable.
It's awesome. I do have to follow up and ask about the music. So I'm not sure if you've tried recently the new text-to-music like AI generators where you can just type a prompt and it'll produce like a full like 2-minute song with like actual lyrics and voice and music. Is that a good thing for music? Is it a bad thing? I'd love to get your opinion on that.
It's a fair question. I've seen quite a few folks, especially on YouTube and things like that, who have kind of made it part of their social media presence of, hey, let's do, this topic and this style of music and have AI generate a song around it. And I find it thoroughly entertaining. However, I can imagine as a genuine human songwriter or musician that is very tough because you are an actual creative and you build your life around it. And so I don't necessarily know if I have a strong feeling in that space on whether it's bad or good. I think it's the reality of where the world is going. So much like some people would say that like YouTube transformed how musicians get founded, and the big record companies kind of going out of business and that not being how you get found anymore as a musician. Like it's just sort of the evolution, and this will be an interesting one to see where it goes, especially for folks who have built their career or are hoping to build a career around those creative abilities. And that's not just in music, but in art, in writing, and in everything. I think there's going to be some very drastic changes in those spaces, and it may not necessarily be good for the people who want to do that. But I think there is also, again, back to people who don't necessarily have musically inclined abilities being able to make music. I think it opens the door for some while maybe making it challenging for others.
I love it. You're a realist. I think that's a home run of an answer. Kali, just being mindful of your time, we're going to flip over to the Fast 5 lightning round. So this is 5 questions to get to know you better. First question we have is, what is your favorite book or book you've gifted the most?
I would say, and I think of personal growth with this one, but Lean In. It came in right as I was coming out of college, right as I was getting into the business world. And I just found that book to be so inspiring and helpful and just practical. Even something as basic as go sit at the table instead of at the chair at the back of the room was, as I'm 22-year-old in the business world, it was good advice.
Yeah, totally. Question 2, who is a person, either dead or alive, who you'd love to meet?
So I'm going to answer both. Dead, it would be Robin Williams.
Oh, yeah.
He was so funny. And every like candid interview I've ever seen where he's not scripted, he's even funnier than the scripted stuff. And so I think just spending 30 minutes with that man, I bet would have been just so entertaining. And then alive, these days it's Mark Cuban. I feel like the more I hear him talk, especially as he's getting into healthcare, so now it's even more relevant to what we're doing. He's just smart, logical, great. I would love to just pick his brain.
Yeah, absolutely. Question for you. Would you rather have super strength, super speed, or the ability to read people's minds?
Struggle with this one. I think super speed. I don't want to know what people are thinking. That sounds terrifying. But I think being able to get anywhere, I'm very much an efficiency person. So if you could cut down the time it takes to get where you want to go, that sounds great.
Love it. Yeah. Question 4, what is something in healthcare you believe that others might find insane?
One, grounded in what I do, is it's the paradox of tech in healthcare, where we have robots conducting surgeries and all this AI coming into the space, but also pagers and fax machines are still a real part of what we do every day. Kind of blows my mind.
Someone's got to keep the fax industry alive.
Yeah,
right? Like
exactly.
you're doing 3D printing of organs and nanotech.
Yeah.
Also, page me when you're done.
Right. That's too funny. Accurate. Question 5, what is the last film or TV show you saw and what did you think of it?
Oh, I just finished Chaos. It's on Netflix.
Yeah.
It's like a Greek mythology in the modern world kind of show. Super entertaining, great cast, worth a watch.
That's the Jeff Goldblum one? Yeah. Awesome. Well, really cool. Kali, thank you so much for coming on the show today and sharing the hour with us. You've provided so much wisdom for myself and Josh and our audience. We're so grateful to have you on. That's a wrap for this episode of The Digital Patient, hosted by SeamlessMD. You can follow us on Twitter @SeamlessMD. And if you like the podcast and want to learn more, visit www.seamless.md. That's like a tongue twister to say. Kali, again, thank you so much for sharing the time with us.
Thank you for having me.